Thank you. It's good to see you, Deanna. Our journey started when Hudson was 6 months old. It was like any other morning. Woke him up, got him breakfast, changed his diaper, and a matter of hours later went back and noticed a large lump in his groin. And obviously we were concerned because it hadn't been there the night before. My husband is a nurse, and we looked at it and decided that we needed to take him to the emergency room. The initial concern was an ascended testicle, and we didn't want to wait in case that's what it was. And so we took him to the emergency room. Doctors initially looked, examined him, thought that was the same thing. They went to do an ultrasound to confirm, and they actually discovered that it was an enlarged lymph node. They couldn't find anything else on his body that seemed out of place or abnormal. So we were sent home and told to follow up with our primary care doctor if it didn't go away. Couple days later, it got a little bit larger. He was reactive when we would try to bathe him or change him. So we took him back to the doctor. They did several tests. They checked for cat scratch disease, a few other things. Everything came back negative. And we ended up back and they finally did blood work then. They put in a request to have a surgeon come down. The surgeon ended up not being available, so they sent us home and told us to follow up with him. About a week later, we followed up with the surgeon, and when they had done blood work he noticed that one of Hudson's levels was extremely high, the ESR level. It was 6 times higher than what was normal. So then the surgeon's concern at that time is that he could possibly have a rare tumor in his stomach. So we were instructed to go directly back to the children's hospital, get an ultrasound done. That ultrasound thankfully came back negative, nothing in his abdomen. So we decided to watch and wait for a month. We did that. They redid the blood tests, and the ESR levels were still extremely elevated. And so that day his surgeon decided, because the lymph node was continuously growing, that it was best to remove it and find out what was going on. So that's kind of how his symptoms and the journey started for us.
Thank you, Allie.
Mhm.
Before we pass it along to Dr. Goyle, I'm wondering if anyone has any immediate questions for Allie right now. Well, I'm curious to know, and I'm sure there'll probably be more after, but I do want to know, Allie, the journey sounds like it came to several hitches, and I'm wondering how you process the emotional toll of being a caregiver in a position and continuously fighting for your son and the challenges that you face and having to overcome them.
It was hard at the time. Most of you know me, so you know that I have 3 children, but Hudson is my youngest. My other 2 are 10 and 12 years older than him. So it was difficult because as a parent, when there's something wrong with your child and you don't know what it is, you have to keep it together, because I have 2 other kids and they're scared because they don't know what's going on with their baby brother. So it was just a lot of bottling up my own emotions, because I didn't have time to be scared or to cry or to let my guard down, because then that would affect my older 2 when they didn't know what was going on. It was a challenging time. I'm very thankful for the surgeon, because I believe that he could have possibly saved Hudson's life. When we went back that day and he decided this lymph node needs to come out, he scheduled surgery the next day. He said, there's no waiting. It's just not in a good spot. We don't like to see things in babies that shouldn't be there. He said it should be a quick 45-minute removal surgery, and an hour and a half into the surgery, he came out to tell me that in his 24 years of practice, he had never seen anything like Hudson's case, and that he found several more enlarged lymph nodes deeper in his groin. They had been able to remove part of the first one, send it to pathology, and they couldn't figure it out. And as Deanna said in my introduction, the lymph node was much larger than anticipated, and he said that it was dangerously close to impacting that femoral artery. And so that's why the surgery took longer. And had he not been so on top of things, it could have been a different outcome for Hudson. A lot of people look at him and he's a wonderful, active, healthy little 6.5-year-old boy now. But had his surgeon not done that, like, he could have lost his leg, he could have lost his life. So that was a difficult time. And then fast forward to getting his diagnosis, took 8 days to get a diagnosis for pathologists to figure it out. We were referred to oncology. Our oncologist had only ever seen 1 case of LCH, and it was a constant battle to get the care that he needed. And we requested a new oncologist. We were denied because his oncologist was the head of that oncology department. And so it wasn't until I did my own research, found the doctors at Texas Children's in the histio department. Once I explained to them what was going on, they reached out to the local oncologist, said, this is what's going on. Based on what this mom is saying, he needs to have these tests. They finally agreed, and Hudson did end up needing another surgery to remove several more enlarged lymph nodes in his groin that were causing him pain. So I think that was one of the biggest struggles that we faced along the way, was to be taken seriously. I'm not a world-renowned oncologist. I don't have a medical background. My degree is in criminal justice, but I'm a mom and I know my child, and I know that he wasn't okay and it wasn't normal. So it was frustrating to not be taken seriously by his local oncologist just because it wasn't in her wheelhouse, so to speak.